Good morning. Across the country and here in St. Louis County, the number of COVID-19 cases that are being diagnosed is increasing. In fact, in St. Louis County, the number of cases diagnosed between June 21st and July 4th increased by 94%. The overall positivity rate increased to 6.2%. This is an increase from the baseline of about 4% that we saw through most of June, but is still less than the high of 15 to 20% that we were seeing at the end of April and all of May, when testing was less available. As of July 4th, we are averaging testing 1,571 tests per day. This is 105% of our goal of testing 1,500 people a day in St. Louis County. We will continue to work on ways to increase testing. We understand that's a very important part of the strategy to control the spread of COVID-19 in our community. Based on data released by the Pandemic Task Force and analyzed by Dr. Christopher Prenner at St. Louis University, the average new hospitalizations for COVID-19 at BJC, Mercy, SSM, and St. Luke's Hospital in our region have increased 26% between June 23rd and July 6th. The COVID-19 associated deaths in St. Louis County between June 21st and July 4th have decreased 85%. This is due to aggressive testing and control strategies in our long-term care facilities and the decrease in the number of positive tests in the age group over 60 years old. We provide a monthly report on the 144 long-term care facilities in the St. Louis region, in St. Louis County specifically, on our website, stlcorona.com. The deaths in May in our 144 long-term care facilities were 197. This decreased to 36 in June. I want to thank and recognize our Department of Public Health for the strategies that they have developed to help our most vulnerable citizens in our long-term care facilities. These strategies were recognized by the Center for Medicare and Medicaid Services as best practices, and they've been adopted statewide in Missouri. The new COVID-19 diagnoses have increased in all age groups across the county, but the most dramatic increase is in the 20 to 29-year-old age group. In this age group, the number of positive cases of COVID-19 has increased by 195%. One example of this is one case, one individual in the 20 to 29-year-old age group who was asymptomatic, spending time at many different activities with 25 different friends, who subsequently 15 of those friends tested positive for COVID-19. Now we are in the process of testing all of these friends and their family members. Now this young person has recovered, and that's good news, but we're still in the process of testing a long list of friends and family members. And I share this story not really to place blame on any one individual. That's not the point. This is just an example of how very real this virus is in our community and how easily it can spread from person to person, even when someone doesn't have symptoms. It's important to take precautions and do everything we can to prevent the spread of this virus. Between June 21st and July 4th, the number of COVID-19 positive cases increased 85% among African American residents, 105% among whites, and 237% among people identifying as multiracial. In that same time period, in that same June 21st to July 4th time period, there was an increase of 42% in our Hispanic or Latinx community. And as doctors, we look at several pieces of data to understand these trends and to give us guidance on decisions that we make. So our St. Louis County Department of Public Health has created a COVID-19 alert system based on 7 pieces of information. This will be a data-driven, standardized framework for considering policy decisions about relaxing or increasing public health orders. The COVID-19 alert system uses a red, yellow, or green dot system for these 7 indicators to help provide us with data to make decisions. And this new system, as you can see in the background here, will debut on our website, sdlcorona.com today. So we use a 7-day average to smooth out any daily variations, and this can help guide us in a very meaningful way in making decisions about our public health orders. Conversations about changes in policy will occur when any of these two indicators become red, or the majority of these indicators are trending in the wrong direction. So at sdlcorona.com, we will begin posting a 2-week collection of data, and we'll compare that to a previous 7-day time period. Data are collected on all new cases for the past 14 days, and then smoothed out with a 7-day moving average. A red dot will occur if there is more than a 10% change in these 4 indicators: new cases, number of household contacts, new hospital admissions, or COVID-19 related deaths. A yellow dot will appear next to these 4 indicators if there is a 10% change in either direction, and a green dot will appear if there is a 10% decrease. For the percent of positive cases, there will be a red dot if there is a 10% increase, a yellow dot if there is a 5 to 10% increase, and a green dot in the percent positive cases if there is a less than 5% increase. In St. Louis County, our goal is to administer 1,500 tests per day. We are well on our way to that goal, and we are currently over that goal, and we are hoping to increase testing in St. Louis County even more. When we are above 1,500 tests per day, there will be a green dot in this indicator. The final indicator will be hospital bed capacity. When we are over 80% of our bed capacity, there will be a red dot. When we are between 60 and 80%, you will see a yellow dot. And below 60% bed capacity, we will see a green dot in this indicator on our COVID alert system. We are currently at 68% of bed capacity in St. Louis County. The number of cases increasing across our country demonstrates that this virus is still very present in our communities. And any relaxing at all of hand washing, social distancing, or mask wearing is really going to make things worse. If you go out this weekend, please give people their space and do everything you can to follow our guidelines. No one is an exception. Thank you, and I'd be glad to answer any questions. Doug, do you have anything?
I think we're good.
Okay. Thank you. Everyone enjoy your weekend.